Welcome to our training. Our training today is on healthcare plans for children with SEND in early years settings. It's written and delivered by the Early Years Inclusion team. The aims of the training is for you to gain an awareness of the setting's legal requirements for supporting children with complex needs, to have an increased confidence to complete that healthcare plan, and to have the knowledge of the recommended SEND healthcare plan. All children with SEND will be part of the graduated response process within Worcestershire. So that is the assess, plan, do, review process, and a healthcare plan will contribute towards this. Another really useful document supporting children with complex health needs guidance needs to be read and taken in. And this document I have attached to the useful documents page at the end of the training so that you can access that, and that will support you as well. There is a six-step program to consider prior to complex children starting your setting. So that's your policies and your admissions process, your partnership with parents, which I think is one of the most important, you being able to set up and arrange team around the child meetings, healthcare plans and risk assessments need to be in place. Your training and insurance, people forget insurance. It's really important that your training and insurance policy is robust, and that the insurance are aware of the complex children attending your setting, and looking at your funding and staffing and making sure that you've got the funding in place to support extra staff and the staff have had the training to support the child that's entering your setting. Policies and admissions. The EUIFS states providers must have policies around any medication the child requires. Then the Code of Practice states that you must make reasonable adjustments and you must promote equality of opportunity for disabled children. So it's really important that you look at your policies and your admissions process. And it might be that complex children may need a staggered admission to ensure a positive and well-planned entry into your setting. And again, this should be reflected in your admissions policy. Partnership with parents. The EYFS states that providers must provide information on daily routines, policies and procedures and how the settings support children with SEND. Does your paperwork support this process, and do you include the local offer in information to parents? It is really important that parent partnerships are strong within your special setting, especially with children with SEND and medical needs, because they're going to need more support and can be more potentially difficult conversations in the future. And parents know their children's better than anybody, and they know who is involved with them, and they know what level of support their children are going to need. As we spoke about on the previous slide, this is our SEND local offer in Worcestershire, and it's really important that this document is shared with parents prior to them starting with you. Team around the child meetings. These are arranged by the setting prior to the child starting and to coincide with a healthcare plan review, if they've already got one in place, and to gather all information about the child from outside agencies and parents. And before these meetings, it is important that you list all the information that you need to know from parents and outside agencies that are attending. And there's a model letter that you can send out, which I think is on the next slide. So we'll talk about that then. This is the model letter inviting parents and outside agencies to contribute to the healthcare plan. It's really important that before you share this letter with outside agencies that you get parent consent. A healthcare plan details how you will support the child with medical conditions. It provides clarity of what needs to be done, when and by whom. Here is the first page of a blank healthcare plan. So you've got the children's names, date of birth, gender, all the service names of outside agencies that are involved and their contact numbers, and a column for parents' initials to say that they're happy for you to contact them, and obviously parents' signature. So that's the most important one. And then we move on to the statements that will support the child's health needs. So this is the next stage of the healthcare plan. There's lots of statements about what constitutes as an emergency, signs the child will display, symptoms that might indicate that there's going to be an emergency, general action to take if it occurs, and also additional action to take if an emergency occurs. So, for example, if they're allergic to anything, it could be that they need an EpiPen and the follow-up care required for that child. This is why it is paramount that parents are involved, because they can offer everything you need to know to go on that healthcare plan. And obviously, so can outside agencies. So it's really important that TAP meetings are set up with these people attending. And again, we can look at if it's something like cystic fibrosis or a very complex health need, that the outside agencies come in and they offer some training to the staff. To make sure that they are feeling confident in what they need to deliver. Also, Orchard nurses and some of the outside agencies may have put a healthcare plan together already, which you can either put in your own paperwork or use theirs. So we're going to talk about contacting emergency services. It sounds so easy, doesn't it? But when something happens and the adrenaline kicks in, it is really important that the staff are concise and know exactly the information that they need to have at hand to offer. So I always say have it next to your phone, all this information, so that whoever picks up the phone to call them, they've got everything there. So it could be making sure that the telephone number's on there and that you've got the location of the school or setting, postcode and everything all ready. Because, like I say, when that adrenaline rush is kicking in and you're being pulled in all directions and they're asking lots of questions, if you've got this written down next to the phone, then it's there and it's relevant. Again, this is just to say that there is a useful contacts and outside agencies part of the healthcare plan as well, so that can also be accessed from it. On the healthcare plan, there's a staff training record. This is really important, especially for complex children. Like I said earlier, for cystic fibrosis or cerebral palsy, so that when the need for extra training from, say, Orchard nurses or OT or physio is required for the staff to feel confident to support the child, then that needs to be logged onto this form, and they will come out, deliver the training, and you can put it all on your training record, so that there's evidence that you've actually trained all your staff in the correct manner. And also, if they come back for review, that can be added on here as well. Inclusion supplement funding, depending on the need of the child, you can apply for inclusion funding to support them. PD Outreach will also provide specialist equipment if occupational therapy assesses them as requiring it for nursery, and your funding can be used for increasing staff ratios, can be used for training, for SEND training, and resources that are specific to the child that are entering your nursery. Here are the useful links to all the documents that we've just seen throughout the training. They're all available on our A to Z of resources and Worcestershire Children's First Inclusion, but you can central and click on them and they'll take you straight through to what you want. So we've got the healthcare plan, a blank one, contact emergency services, really good document. You can print that off and put it next to your phone. Supporting children with complex needs guidance, that was the information I showed at the beginning, as well as supporting pupils with medical conditions in school. And your SEND local offer is there as well, which should always be shared with parents prior to starting your setting. Any questions, you can contact our Early Years Inclusion Team helpline on 01905 843 099 and leave a message if nobody picks up. And our Early Years Inclusion email is there, so you can always contact on that, and that is our web page underneath where you can access our A to Z of resources. Thank you for listening to our webcast today.